So we're going live in 3, 2, 1. Good evening and welcome everybody to this Wednesday music program. And today we will be talking about a very current topic on the guidelines that are revised in last year and are currently being implemented on all of us. I'd like to welcome Dr. Tarang, who is our coordinator for today, and hand him over the proceeding. Over to you, Tarang.
Yeah. Hello, everyone. Good evening, everybody. Good evening, Borate sir. Welcome back.
Yeah.
And so essentially, code of ethics, I would say not just medical ethics, but code of ethics would be a guide or a set of rules designed to help professional individuals to conduct their work efficiently, honestly, and with integrity. Now, when we speak about medical code of ethics, it is about how a practitioner, be it any medical practitioner, modern medicine to be precise, how to do ethical practice, how the patient should benefits of patient should be kept as priorities, and how he should conduct himself in his fraternity, in the medical fraternity as well. And Borate sir, and today's topic is a very no nonsense topic, and for a moment it is a very technical topic, but Borate sir is here to help us get through all the technicalities. And it is a very vast topic, and let's see how much with the time constraints and with the scope of 1 week, how much we'll be able to cover this up. So Borate sir, over to you. And this medical code of ethics has been formed long back, and it has been amended by the MCI or the NMC in latest. It has been amended by in the last year. So Borate sir will take us through all the chapters included in this document. Over to you, Borate sir. So you are on mute.
Yeah. So first of all, I'd like to give some information regarding this code of ethics. We need to understand that when medical practice and its regulation was formalized after independence with the formation of the Medical Council of India, the amount of or the number of doctors who had qualifications in modern medicine and who were officially engaged in practice in various parts of India were in very small numbers as compared to what was required in relation to the size of the population. Okay, so it was there were two problems. One is those that were engaged in practice were it was not very difficult for them to abide by whatever guidelines were in existence because there was very little competition. And secondly, all the other people who were not postgraduates or graduates in modern medicine were also practicing, but there was not much of conflict because the amount of qualified doctors being less, it was very easy for the public to differentiate between a doctor of modern medicine as compared to the other traditional doctors who were in existence at that time. And therefore, there was not much of real conflict in any way. So it happened that all the other non-registered or non-official or practitioners of other systems continued to coexist in a fairly peaceful and a confrontational manner with the existing medical doctors. The other thing is that whatever this code was in existence was implemented through the state medical councils. And in the initial 20 or 30 years, the state medical councils were able to eh, to do their job uh, fairly efficiently because of the limited numbers. Okay. But as the number of new graduates started increasing, and as the work of the mm, state medical councils started increasing, and various problems started to crop up. Unfortunately, if you look at the last 50 years, there has what should have happened was a system of recommendations and review, which should have originated from the practitioners through the councils and represented to the medical council, and therefore effectively modifying things did not happen the way it should have happened, and is not happening even today. So this is one of the problems that we have. And although there have been some amendments in 2009, 2016, and so on, most of these amendments have not been in in the interest of the uh, newer problems or the changing scenario and the requirements that came into existence for the medical profession. The only thing that I could discover in this whole thing was that the medical council, which previously did not exempt professional bodies of doctors from having the same code of conduct in terms of whatever their jobs or roles were, has now exempted these professional bodies from the same stringent requirements of ethical behavior in terms of doing their job as professional counsel. So that's the only thing that I see that seems to have been heeded as a result of the representation by the doctors and their professional bodies. Now, another thing that I wish to clarify is that we must understand that these are guidelines, and a lot of these things are supposedly to be followed, and it is expected that they will be followed by all the doctors. However, the medical council, if you look at the punishment part of it, has very little judicial authority other than to cancel the license of the doctor or to bar him from doing practice. So, this is also something that we should understand. Of course, in a real sense, if a doctor is officially barred from doing practice, it is like a death warrant for him. So it's a very, very serious thing for somebody to be officially declared as uh, unfit to practice, or debarred from practice. Uh, so, but there is no other punishment that is within the purview of the medical council. They have recently introduced certain fines and so on, but those are also really not all that much of a deterrent as one can see. One thing that I have to admit, and I'm very sorry for, is that as a medical student, a medical graduate, postgraduate student, and a postgraduate medical student, I was never actually taught this code of ethics. Nobody explained to me the various aspects of this code, and it was left to me to find out about it. The only way that most of us, at least as far as I can see, uh, came to know about these things was through talks that discussions that happened with our teachers and seniors who would tell us things, but they would not really go into details and teach us in a very methodical fashion some of the things that are quite clearly and quite uh, definitively outlined in this whole guidelines. uh, I have talked to many doctors, many lawyers And I have learned talks by lawyers who are experts in medical legal litigation, and they have always told me, and they have always told in these lectures, that the reason why doctors do not get into trouble with the law is because they are either unaware or not seriously, do not understand the seriousness of following the guidelines that are enshrined in the code of conduct of and the guidelines of the medical council. All, all the time that the doctors have been found um, negligent or found uh, culpable has been when a clearly defined, clearly explained uh, thing in the code of conduct has been clearly violated by the doctor. So, with these little preamble, let's go to the actual uh, code of ethics. It is divided into 8 chapters, and those chapters are: the first chapter is about the code of conduct. The second chapter is duty of the doctor to his patients. The third is about responsibilities in consultation. The fourth is about responsibilities of doctors to each other. The next is duty to the public and paramedical staff. And the last 3 chapters are about what is wrong, what is unethical acts. Unethical acts have been defined and outlined. And in the 7th chapter, what is misconduct has been defined and outlined in various forms. And the last chapter is dedicated to what kind of punishment will be awarded to the doctor if a complaint is lodged against uh, that doctor. Now, 2 things I would like to say uh, right away, that unless a official complaint is lodged by someone, either by a doctor against his colleague, or a patient against a doctor, or a member of the general public who is or becomes aware of some unethical conduct on behalf of some doctor, nothing actually happens. That is, the medical council, acting through its state councils, does not take cognizance suo moto of anything that is happening in the professional sphere of medical practice unless it is officially brought to their attention. Uh, this is something that we have to introspect and reflect upon as to whether we should start thinking of the concept of like public interest, where a lot of the laws are being questioned and a lot of conduct of various institutions in society are being questioned through what are known as public interest litigations, which the courts are also taking up because they feel that they are important enough to go into. This is not ever happened in the medical profession, but it is time that we should start reflecting on these things. Now, coming to another aspect of the same thing is that because many of these things have become difficult to practice in light of the increasing numbers of doctors engaged in practice, especially in the urban areas of the country, and also because of the need for the medical profession to make the public aware of what kind of treatments are now available for illnesses, in the hope that that will help the public to seek those treatments. Uh, there is a lot of technological availability of media and other mechanisms to educate the public, like the social media, for example. So many of these things that are considered to be absolutely written in stone in relation to doctors advertising their services or doctors educating, promoting themselves to the public need to be re-examined, and certain changes and modifications need to be made in the way these rules exist, at least in India at the current time. There is a lot of debate that is going on in other countries, particularly the United States, and the courts as well as the medical councils have accepted the concept of uh, promoting your practice by doctors, as well as the promotion of available treatments and various aspects of those treatments, and educating and informing the public uh, as a part of the duty of the doctor, and therefore allowing this to happen in a certain format and in a certain guided manner has led to some modification in their code of conduct. This is somehow completely uh, been ignored by our medical profession themselves, uh, in the sense of representing about it, talking about it in the associations, making representations to the medical council. All that is not happening to the extent that it should be happening. Whereas the ignoring the various stringent provisions and being part of a system which, through various uh, loopholes in the guidelines, or areas where there has been no cognizance, like social media is not mentioned in this code of conduct, for example. So the medical profession as well as the healthcare deliverers like the hospitals have been testing the limits of all these guidelines. And it is only when there is a conflict between the state medical councils and the hospitals or the doctors' associations that these things have come to the fore. Right now, there is a stalemate that the medical councils have maintained that they are not willing to make any exceptions in any form to the existing guidelines, and hospitals are not allowed to promote their services as much as medical practitioners themselves. So, other than making exception for professional associations in the way they conduct their business, no real change is there, at least in the rules and the guidelines regarding hospitals and the permissibility of hospitals to educate the public and, in a way, advertise themselves. So, with these few remarks, let us go to the first chapter, which relates to the code of ethics. Now, I am going to uh, give a very quick look at these things. Um, One thing I will wish to emphasize here is that whoever has designed this code had firm belief that the medical profession's job is to serve humanity. It is to heal the sick, and at the same time acquire as much knowledge as one can about disease, and continue to acquire that knowledge and use that to help your patients, and also to practice scientific medicine, which is something that a lot of physicians need to understand, because it is only mentioned, the word scientific basis has been mentioned, and the word constant improvement of knowledge has been mentioned. And both these are supposed to be the responsibilities of the doctor. So these are things that need to be understood in more detail. And I'm not sure whether the practicing medical doctors are aware of the what kind of methodology they have to use. I'll give you a simple example. As a practicing doctor, if I prescribe some medicine to a patient and there is some side effect that is reported by the patient, okay, and I read about it, and to the best of my knowledge, that side effect has never been reported anywhere in the books and journals that I have referred to. It is my duty to report that to a journal, because that is the only way that scientific and medical knowledge can be advanced. So every doctor, when they are practicing medicine, when they find something that is different from what they have learned, they are supposed to use that and convey that in a manner that helps the entire profession. Now, this is what is expected. Now, to what extent it is practiced by all the doctors who are practicing, not only in India, but everywhere in the world, remains to be seen. Uh, the more stringently this attitude, the scientific temperament is inculcated and practiced by doctors, the more quickly we shall be and the more efficiently shall be able to render better service, better cures, and advancement of knowledge. Uh, this is what is defined as maintaining a good medical practice. There are, of course, some things that are mentioned very clearly about character. Now, in character, it is believed very strongly that doctors should not practice medicine for financial gain. Financial gain should be a subordinate consideration. Helping the patient, doing whatever is necessary for him, should be the primary concern. And when you say subordinate consideration, it also implies that whatever is the patient has, you should be happy with that. Something to that effect. There is also a very clear directive that a doctor should be qualified to practice. So nobody who is not qualified should practice. That is very clear. However, we know and we have been seeing over the last 50, 60 years that as the benefits of modern medicine and the benefits of, say, antibiotics, the benefits of various treatment modalities became apparent to doctors who were not officially or trained, started using these medicines and practicing that kind of medicine without any control and without any accountability or responsibility all over the country. Our official organizations, associations, state medical councils have been unable to do anything about it. And under the guise of the fact that not enough qualified doctors were available, the political establishment and the bureaucracy has not supported the medical profession in clear distinctions between these two uh, contradictions, that a large number of unqualified doctors are being allowed to practice and use modern medical methods, sometimes even officially, through passing of various legislations, which the practitioners of medical associations have been unable to stop. Although our guidelines clearly state that a person obtaining qualifications in any other system of medicine than modern medicine is not allowed to practice modern medicine. We are being labeled as allopathy by uh, I don't know who, to compare us with other branches like homeopathy, Ayurveda, and Unani, and so on, as if we are just one of 4 or 5 options of medical practice that are in existence. But the fact is that ours is the only system of medicine that is based on science, whereas all the other medicines or other systems are based in traditional knowledge and the use of that knowledge and the wisdom acquired from that knowledge to heal people. They are not based on science. and therefore they have a huge limitation. But however, this distinction is not properly uh, impressed upon on the public, and the primary uh, role of the medical council, as well as the state councils, as well as every practicing doctor, to impress this constantly on the society, is a very, very important thing that we are not doing effectively and efficiently, as far as I can see. Doctors are also required to be members of professional bodies, the medical associations, associations of specialists, and so on. Doctors are supposed to keep a register of every certificate that they issue with full details, and are supposed to verify every certificate as being valid or false. I have been involved in some certificates which were questioned by certificates which allowed concessions in travel, where the Indian Railways presented a bunch of certificates to our hospital and asked us to verify whether these certificates were actually issued by the hospital or whether they were fake. And to our surprise, we found that all of them were fake. And we had to actually officially go to each one and mention that it was not issued by the hospital. So these are things that uh, do keep happening. Doctors are supposed to maintain medical records. Now, this also is a clear directive. It says 3 years, but as far as is feasible, doctors are supposed to try and keep uh, records of patients whom they have treated as much as possible, as far as possible. They must display their qualifications. They must affix their registration numbers whenever they prescribe anything, to let the pharmacist know that this prescription has come from an qualified person. They are supposed to be very discreet in what they affix to their name. So if I have acquired an MBBS degree and an MS degree, I should only use that in my name. Any other qualifications that I have acquired, which are not degrees or diplomas, but only certificates, are not supposed to be affixed to the name of doctors. Now, you and I know that a large number of medical practitioners are either unaware or ignore these clear guidelines. Doctors are supposed to know the generic name of drugs and use drugs in their generic form, so as to enable the pharmacist to make the cheapest version of the drug available, because all pharmacological companies may have patents of certain drugs and may be using commercial names which enable them to charge more for that particular formulation or that particular chemical. So doctors are supposed to actively discourage the profiting out of the drugs and medicines that are available to the public. Doctors are supposed to provide quality assurance. Now, this is something that most doctors uh, are consciously and unconsciously trying to practice. But doctors who are working in rural areas, working in very poor and very remote locations, often find it very difficult to practice all the things that they know that should be done. And therefore, it is very difficult to continue to have quality assurance in a society where most of your patients are unable to afford the cost that quality assurance requires. Uh, Doctors are supposed to not only be ethical themselves, but if they find anybody doing anything unethical, they have supposed to expose it. They're supposed to complain about it. Doctors are supposed to charge very reasonable fees, and they are supposed to tell their fees before the patient is undertaken or examined by them and treated by them. They are also supposed to display their fees in a manner that does not leave any doubt in the minds of the patient. They are also not permitted to have any contract about payment only if you are cured and anything like that, and so on. And doctors are supposed to obey the laws of the country. They should obey all laws relating to pollution. They should obey all laws relating to narcotic drugs. They should obey all laws regarding transplantation of human organs, mental health, environment protection, magical remedies, and all kinds of laws pertaining to health, disability, biomedical waste management, everything. So it is uh, required by all doctors to become aware of what are the legislations that exist and follow them. Now, this is in brief about the code of ethics. Now, the second chapter relates to what is the duty of a doctor to his patient. And here it is much more specific that, first of all, what is the obligation that a doctor has to the patient? The doctor is not bound to treat each and every person who comes to him for help. If he is not in a position to treat that patient because of certain professional issues or the awareness that he doesn't have the knowledge that is required to provide the treatment or help that is required, he has the right to refuse to treat a patient for reasons that I just outlined. He should, however, provide emergency and life-saving help to every patient, irrespective of whether he chooses to continue to treat the patient uh, till such time as another patient is available or he can hand him over to the care of another patient. He is supposed to provide life-saving attention to the best of his ability to every patient that is brought to him for treatment. But if whatever is happening is beyond the range of experience or expertise of the doctor, he can refuse further treatment and refer the patient to another doctor or another uh, facility which has the expertise that he knows is available. They also uh, should not practice if they have some disability that does not allow them to practice. For example, if a doctor has a physical illness which is not allowing him to exercise his mental abilities, then he should himself stop treating patients. Doctors should exercise patience and secrecy. Whatever has been revealed to them by the patient about his health or about his personal matters is not supposed to be, is confidential and is not supposed to be shared with anybody else unless it is necessary in the course of referral to another physician to disclose such information. Sometimes, as a duty to society, the doctor may have a moral obligation and a legal obligation to society to disclose if the patient has some disease which is communicable, for example. And in those circumstances, it is the duty of the doctor to notify the health authorities about such a illness. We all know that certain types of such directives are in existence about, say, HIV and about other communicable diseases. What about prognosis? Should the doctor tell the patient about the extent of his illness, the severity of his illness, and the possible outcome of the illness that the patient has? Now, it is important that the doctor gives truthful information, but it is important that he neither exaggerates nor minimizes whatever is apparent to him or whatever becomes known to him after examination and investigations of the patient. So, sharing the prognosis is an important thing where balance is required, and neither going in one direction or the other is uh, which as might be detrimental to the patient and his uh, mental condition should be avoided. A doctor should not neglect to treat anybody. If he is aware of the need to treat somebody, if he is aware that a patient requires emergency care, if he is aware that patient needs monitoring, so whatever he is aware of, he should be doing and he should not neglect it. And then, of course, there are some provisions for obstetric cases. The next chapter talks about doctors' responsibilities when they are consulting patients. So, no unnecessary consultation. So, if a doctor, after seeing a patient, examining him, and doing some tests, is clearly convinced that he has what is the diagnosis and what is the treatment, it is not encouraged for him to unnecessarily involve other specialists in the consultation, which may increase unnecessarily the cost of care to the patient. Doctor should, on the other hand, refer the patient to other doctors if he feels that it is in the patient's benefit. Doctors should make sure that they consult patients in time. They don't make them wait. They don't delay their consultations or additional referrals as the case may be. Uh, how the doctor conveys whatever he has found to the patient also is very important. And a genuine opinion that he needs to consult others should be shared. If there is a difference of opinion between two doctors, it is necessary that there should be an explanation, and uh, unless there is a complete uh, conflict between two opinions, the doctor should help the patient to make their way out of the problem that has arisen because of different opinion. Doctor should not insist on a particular type of treatment unless the patient agrees to the same. They should not also insist on a certain type of treatment unless the patient has exercised his freedom and has chosen to agree to whatever the doctor is suggesting. So if the patient says, I want a second opinion, the doctor should respect it. If the patient says that I don't want to take the treatment that you are suggesting, the doctor should then respect that, but uh, convey to the patient that he will be unable to treat him anymore if he is not willing to follow the advice or the treatment that the doctor feels is right for the patient. Whenever the doctor refers a patient, he should refer in good faith and provide all the information that is necessary to the doctor who is going to see the patient as a result of that referral. A doctor should clearly not overcharge, display his fees, and so on. Now, the next chapter is very important, and I find that a lot of this is a matter of um, uh, concern that I have noticed in my career as a practicing doctor. How doctors should behave with each other. Doctors are supposed to respect each other. Doctors are not supposed to, poach on other doctors' patients. Doctors are not supposed to unethically and secretly uh, or surreptitiously go and see patients who are being treated by other doctors. Doctors should not scheme and manipulate to take charge of a patient who is clearly under somebody else's care. Doctors should be very clear when they appoint a substitute. Doctors should be very clear about their conduct when they are asked to see or they are seeing another patient, a patient being treated by another doctor as a courtesy or as a request from the relatives. So there are very clear guidelines on all this. And I have found very frequently that doctors are not, a large number of doctors are not abiding by the guidelines mentioned in the chapter on responsibilities of doctors towards each other, particularly where the senior doctors in the profession are involved in relation to other doctors who are junior to them. The next chapter is about duty of the doctor to the public and the paramedical staff. Doctors should above all be good citizens. They should do everything that a good citizen is required to do other than being good doctors. They should encourage debate on health issues. They should inform the public about important public health issues and concerns. They should play a part in enforcing laws relating to health and hygiene and so on in the community. They should also cooperate with authorities in the conduct of any sanitary or public health laws. Like we went through this COVID pandemic, and the medical profession had to play a very important role in cooperating and implementing whatever guidelines were being issued in the interest of the general public at large, in the control and the management of the pandemic. Doctors have a duty towards community health, as I already told, and doctors must constantly have a cordial relationship with people in paramedical services like pharmacists, like nurses, who work with them and often under their supervision. And they must treat them cordially and as fellow professionals and ensure that they are constantly uh, made aware of the newer changes and so on in the profession. I think that I have now spoken about the 5 important chapters, and as suggested by Tarang, the next 3 chapters relating to unethical acts, misconduct, and punishment, we should discuss at the next
Sure.
musing, because this 5 chapters uh, uh, we need to discuss a little more and uh, not go beyond into the last three chapters and leave
Yes,
them for the next musings.
yes, 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 sir.
Yeah.
Yes, sir. So absolutely. So before the lose the grip, let me just mention or summarize the headings of the 8 chapters, starting with the code of conduct of doctors, and then the second chapter regarding the duties of the doctors to the patients. Then it is the responsibilities of the doctors in the consultation. Then fourth chapter is the responsibility of the doctors with each other. And the fifth, which one we discussed in detail today, is the duty of the doctors to public and the paramedical staff. They are so paramedical staff. The last 3 chapters, that is the unethical acts, the misconducts, and the punishments regarding the same, will be discussed next time. And very nicely, and a point I would like to mention here, like Borate sir mentioned, during his days, he was not taught specifically the code of conduct. That could be precisely because there were a handful of practitioners, and now the number of practitioners is increasing exponentially, and definitely we need to spare some time into the syllabus to teach the code of conducts, because very valid points which are very taken very lightly by the young practitioners, like you mentioned about what degrees to be mentioned in their holdings, about the advertisement we mentioned about today as well and last time as well. Then regarding the prognosis, then regarding so many points that I can't just summarize them in a nutshell. So that is why we plan to extend this meeting to the next Wednesday musing. So over to you, Ashok, Shyam sir.
I'd like to talk a little bit about the COVID pandemic and the chapter 5
Yeah.
about the duties of doctors in such situations. I felt personally that all of us, the authorities who were uh, administering the country at the central and the state level, and the medical profession as such, uh, we saw a lot of uh, lack of coordination from the authorities. We found that the authorities somehow were completely unable to tailor and use the expertise of the medical profession and their presence within the society. They kind of behaved as if management of the pandemic was a matter of administration with the help of the police and the revenue authorities rather than the medical profession. I'll just give you one example to illustrate what I'm saying is when the issue of vaccination arose and vaccine became available to be given to the public, the authorities did not, for example, bother to find out that all over the country, the vaccination program before the pandemic for all vaccinations was being quite efficiently administered by general practitioners or family physicians and pediatricians. And they were not only aware, they were trusted by the public and they knew all the precautions. But the entire vaccination program relating to COVID has been kept out of the hands of this large segment of healthcare personnel for reasons which nobody has ever been able to explain. It was decided by the authorities in their wisdom that only hospitals can give vaccines without really any logical reason, where vaccines were already being given officially and allowed I mean, pediatricians were allowed to give vaccines for the last 50 years. And why they were not allowed to give vaccines and acquire vaccines? And they were already in the community. Patients were already going to them and trusting them. So this is something that I find that whenever there is a public health issue, treating it as an administrative issue is a mistake that we should avoid in future, at least the authorities. And the professional associations should also work to design what I call as a disaster management system for public health emergencies, like we have for disasters. We we seem to our associations were not in a position to do anything uh, with this pandemic. So we should be more aware of this aspect of the role of the doctor as a public health mm, disseminator, as a part of the public health network.
Right, right. When situation is like that of a war front, this is an example of how doctors can disseminate their services, and
And
collectively they can work along with the public and paramedical staff.
it is a two-way street. The government also did not utilize the huge amount of expertise that was available with the medical profession, and the medical profession itself did not have a proper streamlined network that could be recommended to the government to implement whatever they needed to implement. Especially, the biggest problem that arose not only in India but all over the world was
Mm.
the confusion and over mm, overdose of information. There was such a big information overload with so much of conflicting information coming out from all sources that the public was terrified and apprehensive, and that apprehension and confusion continues to this date amongst a large number of people all over the world. So this is something that we need to introspect upon.
Absolutely. I think we have lost Ashok Sham, sir.
Okay.
Hello.
Yeah.
Am I audible, sir?
Yes.
Yeah, sure. So that
So
was
we'll
yeah. So
continue to chat
and
amongst ourselves for a few minutes in the hope that he'll come back.
sure, sir, sure. Yeah, so like you said, and a very good example which clarifies the chapter 5th of the duties of the doctors towards public and paramedical staff, that regarding during COVID times. It was, and like you also said, it is a two-way street. Just only if doctors decide to work in a certain pattern, you cannot help that much without the support of the government or the guidelines, the institution setting the guidelines. So that was about the first 5 chapters, and in next we will be discussing in depth about the unethical acts, the misconducts, and regarding the punishments.
So one thing that I would like to say regarding this, the existing guidelines and rules is that I think that we should be proactively, uh, using our professional associations to reinforce the importance of the existing guidelines such as they are amongst their members, and also creating a debate amongst their colleagues to discuss and define the need and recommendations for change in the guidelines as they exist and represent the same to the state medical councils or the Medical Council of India for consideration. Because without this proactive attitude, we will not be able to bring about the changes that are needed and the acceptance and implementation and following the rules by everybody, so that the few people who are not following the rules are exposed and properly punished, rather than everybody ignoring all the rules because nobody is following them. We are in a similar situation like the traffic that we see on the roads of India, where a large number of rules exist which nobody follows. So if we had to get out of that situation, I think that the professional bodies that we belong to, like the Orthopaedic Association for Orthopedic Surgeons and the Association for other specialists, whatever they exist, should be engaging in more debates and more reflections, and form committees to give recommendations um, relating to whatever is actually happening and how that can be reduced, or if necessary, how modifications to the existing guidelines should incorporate the needs of a changing society and the availability of public education technology through social media, which needs to be, which requires modification of guidelines. So if I start a blog and I start writing about various things that I have been doing well in treating certain diseases, am I advertising myself? This is a question that is not answered, because a blog is something that I'm legally allowed to do. And I'm not forcing anybody to read it. But if anybody wants to read it, it is there in the public domain. So I'm not putting an advertisement in a newspaper by paying money so that everybody will be able to read it. But
Right.
I am certainly using the freedom of expression that is allowed by the media, social media, and which allows me to be out there and for people to read and uh, follow whatever I'm saying if they wish to. And if I'm doing it well, then I become more popular and people start reading and people start asking questions. And so very soon I could become a influencer, because
Right.
people will say that this guy is good. So then all kinds of issues that conflict with the medical council guidelines will be happening on a regular basis. So I will be asked to give opinion of the opinions of others. I'll be asked to comment on, treatment given by others, and so on and so forth. So all these things need to be debated and, talked about, and we have to find our way out of this. Or,
Absolutely.
yeah.
So when you spoke about the blog, it is just you are informing about that particular disease and the treatment in a language, in a simplified language. I don't think that should be a problem, unless you are claiming that only you can give so and so results, and claiming such misinformation. So I think
So, for example, in my I write a blog in which I systematically uh, 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 describe various ways in which doctors uh, abuse their knowledge and try to take advantage of the ignorance of the patient to make profit. I'm just saying, and if I keep documenting it as my own, information in the public domain, is it wrong? Is it illegal? And if, as a result of that, I get a lot of following And I am in conflict with the medical profession because, without naming anybody, I am exposing certain unethical practices like kickbacks and other inducements that are happening in the practice. Is that right or wrong? Because these are things that will happen and are already happening. You know, so we really don't know. We need uh, to look into all these things.
Right. And like the example of traffic signal which you mentioned, uh, everyone is also not following the rules. That is true, but every vehicle owner is blaming the other, and blaming the other system. Probably they are blaming the potholes or the mismanagement of the traffic, and they themselves are not following the rules. Even if every community, every doctor in our community starts abiding by the rules, things will be much easier.
Yeah, and also the benefit of following the rules is very indirect. It does not guarantee that anybody will be safe, but it reduces the risk of accidents in general, and therefore improves the safety of everybody in particular or in a general way. In the same way, if the medical profession is mindful and following on observing all the guidelines that have are self-imposed, it will ensure that they are perceived in a better way by the public than what is happening today, and the respect for them and the problems that they are facing vis-a-vis a hostile public will get reduced. See, because we cannot really, we are not willing to reflect on the fact as to why is it that there is more litigation than what there was, say, 20 years ago or 30 years ago, or that why there are more incidents of dissatisfaction and violence against doctors and hospitals and so on. And while we are definitely unhappy of the support and the protection by the law enforcement authorities, we are not willing to look at uh, the reasons how we can reduce the lack of trust that has now become endemic between the doctor and the public. We can increase that trust. What are the good things that we can do, that we should do more? What are the things that we should not do or do less and less, which are creating this feeling of mistrust and suspicion? All these are things that are the corollaries of following rules. So, if rules are there which need to be followed, we should follow them. If rules are there which need to be changed, we should change them. If certain practices that will improve the communication and the trust between the community and doctors that need to be done and that need to be recommended by the medical council, that should be done, rather than just looking at how we should be more protected by the law enforcement, how the political and the administrative mechanisms should be uh, more sensitive to the protection and need of the medical profession. While these are legitimate concerns, um, we have to also approach this from our side in a proactive manner. I would like to see that happen more in an organized manner. I'm not saying it's not happening. It is happening. People are taking interest in these things. Uh, all doctors. I mean, uh, we know for a fact that the majority of people who are in the profession are good people. They're decent people. They are not. They value their uh, uh, rules, and they are honest, law-abiding people who want to help people who are sick. There is nothing that is um, that is wrong with the basic character and the basic way in which we exist as a profession. But there are some things that we need to look at little more carefully to see how we can change the perception. What we need to do more and what we need to do less. That's the simplest and the most kind way of putting it.
Yes. So we have discussed extensively on the first 5 chapters and topics surrounding them.
Yeah.
And so we'll meet next time with the remaining 3 chapters. And if Ashok Shyam sir is here, he will log off. Or
Yeah, I'm here.
Yeah. Thank you, sir.
So I think it's very, very important for us to understand these chapters and the points that are made in these chapters, and also in-depth analysis like sir has presented. So not only superficial knowledge, but analysis of these chapters is really essential for us in practice. So look forward to next week for the next 3 chapters.
So I would like Ashok to hear more from you about how the medical profession in general and the professional associations of doctors, including the Indian Medical Association and the state medical councils and the National Medical Council, should be addressing the changes that technology has brought in information dissemination, like the social media, like, availability and access to knowledge that has become a very crucial factor in society today, and which the medical profession is either confused or uh, poorly organizing itself to deal with.
No, I think this is an important point, and we this is a really evolving area, and as we grow, as the social media grows, specifically for doctors and patients with respect to health,
As
especially preventive aspects.
as someone who is quite interested in research and research related literature, how much do you see all these aspects being reflected in the journals and scientific publications?
They are coming through slowly, but I think much impact of social media is into preventive medicine and into creating awareness about diseases amongst general populace. So that is an area where social media can be very, very effectively used. It is not being used, it is used by individual people to put out content which is half promotional and half uh, knowledge. But it is a very, very good tool to do that, because there is no other way where such large population can be accessed on single or just few platforms. So I think it's a very, very good tool for patient education and preventive medicine. uh, let's see how it works out. I mean, future will tell us.
Yeah, another thing that I feel that is lacking in the professional associations to some extent is the um consultative mechanisms for doctors who need guidance with
Absolutely agree.
with
Absolutely agree
grievances
with you.
that they have relating to the guidelines, and the grievances the ignorance or the confusion that they may have. Those we are lacking, and we need to do something more actively at the level of the associations and regulatory bodies as well. Right.
Yes, sir. So let's say we'll discuss out few more things next week.
Okay.
So over to you, Tarang, to conclude the session.
Yeah, so we have discussed the 5 chapters. Just to summarize them, they include the code of conduct, the duties of the doctors towards patient, the responsibilities of doctors in consultation, and the responsibilities of the doctors with each other, which is a very important point, and the duties of the doctors to public and paramedical staff, and the recent COVID pandemic being a very good example cited by Borate sir. And the next meet, we will be discussing about the unethical acts, the misconducts, and the punishments regarding them. Today's meet was about very technical laws, and the next meet will be more of descriptive. And so we decided to do that with the time constraint for one meet as well. So all in all, it was a wonderful meet after a gap of 1 week, and we hope to see you next Wednesday with continuation of this topic.